to do some show notes and kind of write out all the supplement stuff. We'll pull the transcripts.
Yeah, and I can share that. I can text or message you guys
like,
later.
Yeah,
because you're like, take Vaza Vuvaga, and I'm like, okay, I want to take it, but what's the brand Dr. Josh Axe likes? Well, I need like the details of it.
Yeah, for those that don't know, I
we'll
think
do a blog post.
Many do know. We have a resource, tscpodcast.com, where we go and write down and highlight all the episodes. And we'll put the notes there. But anyway, there's on this subject, we went to a dinner with a really interesting group of people recently, a lot of people in the longevity space. And one of the questions it was like a Jeffersonian style dinner. And one of the questions was, if there was an algorithm that existed, that if you took it, you would have perfect health, perfect mental, well-being, all of these, perfect sleep, perfect, you wouldn't be depressed, you wouldn't be anxious, all that. But you had to follow it specifically. If it told you to stop eating at 11, you had to stop. If it said you had to go to bed at 3:00 in the afternoon, you had to do it. Like you had no personal will. And went around the table and said, like, would you follow that or not? Most people said no, because they justify all these reasons about they want free will and all of that.
Yeah.
And some people said yes. But anyways, at the end of the discussion, I said, well, there's algorithms like this that are starting to exist. If you would have asked people 5 years ago, would you take a shot that would suppress your appetite and slow your digestion and make you lose muscle mass, but you would lose weight? Would you take it? Everyone would say no. But now there's Ozempic. He says, now fast forward 5 years. What if there is a quote unquote Ozempic or Wegovy, but for depression or for hair loss or for cognition or for better sleep? All of a sudden you have all these people doing these things and they say they wouldn't do it. Like if I said to everybody, you're taking 5 shots a week into your ass, but it would perfect all of these things and put you on autopilot, most people listening are like, I would never do that. But as soon as these things become available, humans don't have the willpower to say, you know what, I might do it the harder way that Dr. Josh Axe says, and I might take the protein and I might do the weight or the weight management through weightlifting and I might get better sleep. It's like, nope, I'll take the thing. But most people say they would never take the thing until it presents itself.
Yeah, well, here's why. I think one big reason. You have people like Oprah and this celebrity and this celebrity and this celebrity who are out there just, saying how much it helped them. And I think also for some people, ignorance is bliss. And at least they think it is for a short time, and then later on in life, then it's not. But I think that's one of the things that happens is we see these influencers and celebrities and things taking these things and promoting them. And listen, I'm talking about the side effects, but there's not many people out there that are. I mean, so.
Because I just think it's like for people to understand, I understand the benefits of a medication like this for people that have like they're at their wits end and they've tried everything and they can't do it and they've got a real problem, and this could be really, I want to, like, for those people, it could be very helpful. What scares me about this stuff is as a species, I think as soon as human beings are presented with an easy path, they always take it. Like we've gotten to a place where we're just looking for convenient, fast, get me down the road instead of like, let me enjoy the process and the struggle. And I think that becomes dangerous because the example I mentioned earlier, which is that long-winded rant about would you take an algorithm, is like we're moving further and further in that direction.
I'm going to remind you of that when you order Postmates and you don't go kill a cattle out in the back and chop wood.
Do you want me to get a cattle and start butchering in the backyard with my axe that I'm going to be chopping the wood?
I'm just saying you're using the easy way out.
My testosterone's going to fly through the roof.
With microplastics in your Postmates. I'm just telling you.
I'm going to chop a cow's head off in the backyard. Don't pull that out of context. It's a joke, people. My testosterone's going to be massive. But no, you hear what I'm saying here? It's like,
I do.
I think if you've tried, what I think about all of these medications or anything like that is if you've been trying and doing all the things that you would prescribe and it's just not getting you there, maybe you might want to try. But I think as a first step and as a first path or as a first step on the path, like maybe that's not the right answer.
Well, here's the reality. Our entire medical system is backwards. What people consider alternative medicine should be primary care. And what people consider primary care should be alternative medicine.
So wild.
And so it's like if somebody comes in and they have type 2 diabetes, I mean, I've helped tens of thousands of people reverse, I'm sorry, you know what? If I'm thinking about globally, now just even my own practice, so it was at least hundreds or thousands of people reverse type 2 diabetes, reverse hypothyroidism, reverse autoimmune disease. And with type 2 diabetes as an example, it really is something that 90+% of the time I was able to reverse with them. In part, let me tell you one reason why. One is I believed in them that they could do hard things. Like you know, I think to a degree, it's thinking too little of people to just think, oh, everybody's only just going to take a pill. No, I think people are capable of doing hard things. I think people want to live great lives. And so that's part of where this starts. And then I think from there, it's, hey, let's follow this diet, this exercise. And exercise could just be walking. You don't have to go in and do hours in the gym. There are really some small steps, and you can reverse a lot of conditions.